My name is Dr. Cameron Muir. I am the Chief Innovation Officer at Capital Caring Health and the Chief Innovation Officer at the National Partnership for Healthcare and Hospice Innovation. The Comprehensive Cardiac Care Program is an incredible set of tools and resources that my good friend and colleague at Capital Caring Health, Altonia Garrett, and I have worked hard on putting together with a number of subject matter experts from across NPHI member programs. The Comprehensive Cardiac Care Program, which is being led through Capital Caring Health as a member of the National Partnership for Healthcare and Hospice Innovation, is truly transformative. The National Partnership for Healthcare and Hospice Innovation is comprised of 70 community-based, not-for-profit, quality-focused hospice and palliative care and advanced illness care providers. We, together with the American Heart Association, which is the largest disease-specific group in the United States, are very, very interested in transforming the culture and quality of care for patients and families living with advanced heart disease.
My name is Altonia Garrett. I'm the Vice President of Public Affairs and Strategic Partnerships for Capital Caring Health, as well as the Executive Director for our Center for Equity, Inclusion, and Diversity. And I am the Senior Advisor for Innovation and Health Equity for NPHI. Cardiac disease is one of the #1 killers of Americans. We thought it would be most appropriate to collaborate with the American Heart Association to establish and standardize best practices for our programs, to support our patients and families, as well as support the healthcare community in understanding the importance of cardiac disease and how hospice and palliative medicine can support individuals living with that advanced illness. We worked very closely with the American Heart Association to help review and assess our information that we put together to establish best practices for the programs and give guidelines of care for patients, families, and our community partners.
The Comprehensive Cardiac Care Program is addressing 3 areas of need, problem, or urgency in the United States with regard to people living with advanced cardiac disease. Number 1, we have the largest killer of Americans, heart disease, and we have some of the lowest utilization nationally of hospice care for all Medicare beneficiaries who are living with advanced cardiac disease. So from a gap perspective and a need perspective, this is our #1 target area to help with quality and access for Americans. Secondly, there is very good information to say that minorities have more advanced and more complicated cardiac disease in the United States than non-minorities. So this is a tremendous opportunity to focus on addressing health disparities and moving towards health equity. And thirdly, underlying cardiovascular disease is perhaps the #1 risk factor for complications of COVID-19 and resulting death. So this is a tremendous priority for us to address unmet need, the health equity opportunity in the United States, as well as very, very timely related to COVID-19 illness.
We have placed emphasis on no place like home, or home has the power to heal. And oftentimes, like now with COVID, home is the best place for folks to receive care and support.
The 3 primary components of the content are #1, information for hospice and palliative care providers that helps them to be certain that their competencies to provide the highest quality of advanced illness care for people with cardiac disease is first and foremost met. #2, there's patient and family education and outreach materials so that the people who are living with advanced cardiac disease are aware that there are resources in their NPHI communities and in the Mid-Atlantic area in particular through Capital Caring Health to meet those needs. And then third, we have an array of comprehensive tools and resources for providers and other healthcare institutions like cardiology practices, hospitals, primary care practices, nursing homes, etc., so that they also can become aware of the tools and resources in their community to help their patients and families that they're caring for, and turn to their NPHI member program or to Capital Caring Health in our particular case to gain access to that expertise and support and service.
In my role as the Executive Director for the Center of Equity, Inclusion, and Diversity at Capital Caring Health, there's definitely a role that we can play to support the efforts of the cardiac care program. As many of us know, the health disparities that exist in the utilization of hospice, as well as those who are living with cardiac disease, are higher amongst the African American populations and other minority groups. The center will work with raising awareness internally and externally, increasing education, and providing tools and resources to guide our community as well as our staff through understanding the cultural sensitivities, the social drivers, and other factors that influence health.
Capital Caring Health, since its inception, has been focused on quality care in patients' homes. Everything that we're doing is bringing more and more support and services to help make that a reality. Still to this day, too many Americans die where they wouldn't want to be and receive care where they wouldn't necessarily choose to receive that care if they knew they could get it safely at home. This is our number one force, is bringing that expertise to your living room so that you can be where you want to be with the people that you'd rather be with.
At Capital Caring Health, we are so excited to explore possibilities to help close the gap in the provision of cardiac care for minorities living with advanced heart disease. I invite you and members of the Academy to reach out to us to share how we can work together to address this challenge.